Sandwich ELISA. Before jumping directly in Sandwich ELISA, let's see what ELISA means. ELISA stands for Enzyme Linked Immunosorbent Assay. ELISA is a primary phase reaction and is used in various diagnostic tests. It was discovered by Engvall and Perlman in 1971. It is a widely used laboratory technique in immunology and molecular biology to detect and quantify the presence of specific proteins, peptides, antigens, antibodies, and hormones. It is a highly sensitive test which is relatively easy to perform. In ELISA, we used enzyme linked antibody, which, when reacted with specific substrate, gives a colored reaction. The enzymes generally used are horseradish peroxidase, alkaline phosphatase, glucose oxidase, lysozyme, penicillinase, and beta galactosidase. ELISA is generally carried out in microtiter wells. All ELISA protocol contain these following steps: coating, blocking, addition of sample, addition of enzyme linked antibody, addition of substrate, signal measurement, and data analysis. There are four types of ELISA: direct ELISA, indirect ELISA, sandwich ELISA, and competitive ELISA. Now, let's learn about sandwich ELISA. It was discovered in 1977 by Cato and his workers. It's called sandwich because it involves capturing the antigen between two layers of antibody, much like a sandwich. The antigen used here must be at least bivalent. Let's see the protocol of sandwich ELISA. The first step is coating. In this, the wells are coated with standard capture antibodies and then are incubated at 4 degrees Celsius overnight. During this, the insoluble antibodies get bound to the wells. The wells are then washed with distilled water to remove the unbound captured antibodies. The second step is blocking. Blocking agents like BSA, gelatin, casein are added. These are inert in nature. Various blocking agents block the excess space between the antibodies and thus prevent non-specific binding. We are going to use BSA as a blocking agent. This step is very important as it prevents false positive result. The wells are then incubated at RT for 1 hour. The wells are then washed with distilled water to remove excess blocking agent. The third step is addition of antigen. In this step, the patient's blood serum sample is added. The serum might contain antigen specific for the standard antibodies and the disease we are trying to identify. If the serum contains the antigen for the specific disease, then it will bind to the capture antibody. After addition of serum, the wells are incubated at RT for 30 minutes. The wells are then washed again with distilled water to remove unbound antigens. The fourth step is addition of enzyme linked detection antibody. In this, standard enzyme linked detection antibodies are added. The enzyme used here is horseradish peroxidase. These detection antibodies bind to the antigen in a sandwich like formation. This is then incubated at RT for 30 minutes. The wells are then washed with PBS to remove unbound detection antibodies. Washing in each step was necessary as to remove errors and prevent false positive results. The fifth step is addition of substrate. In this step, the substrate for the specific enzyme is added. In this case, the substrate is TMB-H2O2. This is then incubated at dark for 10 minutes. During this, the substrate reacts with the enzyme to give a colored reaction. For example, TMB-H2O2 reacts with horseradish peroxidase to form a conjugate TMB-O, which is blue in color. After this, stop solution is added, which stops the reaction, thus preventing non-specific coloring. We use H2SO4 as a stop solution. This is how sandwich ELISA is performed. Let's check the quantitative and qualitative assessment of sandwich ELISA. If we want to qualitatively assess if antigen is present or not, we can comment by observing the color development. If there is color development, it indicates that antigen in the study was present in the sample. Whereas, if there is no color development, it means that the antigen in the study was absent in the sample. Now let's check the quantitative assessment. If we want to quantitatively assess, then the standard antigens of different concentrations should be made and tested, and the color development should be measured using ELISA reader. Then the unknown should be tested and its color development should be measured by the ELISA reader. After this, a graph is made. In this, the y-axis is denoted as OD readings and the x-axis is denoted as the concentration of the standard antigens. Then the unknown is interpolated and its concentration can be estimated. Let's see the advantages and disadvantages of sandwich ELISA. First, we'll see the advantages of sandwich ELISA. First, minimal sample purification is needed. Second, it is highly specific. Third, it is highly sensitive. Next, we'll see the disadvantages of sandwich ELISA. First, difficult to make antibodies for specific antigen. Must use matched pair of primary and secondary antibodies. It is time consuming and expensive. Thank you.